Hello there. Welcome to the Nature of Work podcast. Since the dawn of time, humans have engaged in what we call work. In the modern world, there are thousands of professions: a plumber, city planner, artist, project manager, fashion designer, firefighters, and thousands more. In this podcast, we want to explore the nature of work through the eyes and ears of such practitioners. What got them into it? What is interesting about it? How do they keep up as well as advance? Why is it important? And how their careers have evolved. We hope it is useful to you in whatever career stage you are. Today, we welcome Sneha Krishnan. Sneha Krishnan is a veterinarian in Seattle. She recently moved to Seattle from Nashville, and we welcome her to the show. Sneha, welcome to the show.
Thank you. Thanks for having me.
All right. I also, in the spirit of disclosure, I want to say Sneha is my daughter. That's not why she's on this podcast. She has some really good insights to share about this often neglected field of veterinary medicine. So I hope this is going to be useful for a lot of people out there. Sneha, let's begin with a simple question. What is your job title?
My current job title is I'm an exotic animal veterinarian.
You are an exotic animal veterinarian.
Yes.
Okay, that's a mouthful. So that means that there must be different types of veterinarians. Can you tell us, like, who are the different types of veterinarians out there?
Sure, yeah. In a broad sense, you have your what you would most commonly think of when you think of a veterinarian, which is a small animal vet. So typically seeing dogs and cats primarily. Then you've got large animal vets who see horses. Some of them will see livestock, so your farm animals. And then you've also got, I mean, there's so many different fields, but we have veterinarians in the research field, of course. If you think of, lab rats and other lab animals, they have vets that actually take care and look at them all the time as well. And then there's wildlife veterinarians, there's zoo veterinarians, and then there's ones that work in industry and pharmaceuticals and all that too. So they're everywhere in pretty much every space.
Wow, that is a large number of veterinarians working in various capacities out there. I believe you've been a veterinarian for about 4 years now.
Yeah.
Uh, I'm curious about the path that you took to get there. Can you tell us what makes how did you get to be a veterinarian?
Yeah, my path, I guess I knew I wanted to be a vet when I was very young, and that certainly helped in making the path more straightforward. And then after finishing high school, I did 4 years of undergraduate education with a major in biology. And after completing undergrad, I applied to vet school and did 4 years of veterinary school. And after vet school, similarly to people who finish medical school, we do have the option of doing a residency, which is not a requirement. We're actually ready to go practice right after finishing veterinary school. But my situation was a bit unique in the sense of we did go through a pandemic during my key year of vet school, which was the last year. And so a lot of us missed out on a lot of hands-on opportunities that we would have been able to do otherwise. And so many of
Uh-huh.
us went down the path of doing a little bit more internship or mentorship right out of vet school because we didn't feel 100% prepared to, take on being a full-fledged vet right after vet school. So that is something I did, was a 1 year long rotating internship in emergency medicine and surgery. So that certainly helped in feeling super confident after just 1 year of a very intense year for sure.
I see. Okay. So if you wanted, could you do like how doctors do MD? What would be an equivalent for for that in for veterinary medicine?
Yeah, so the equivalent of MD, medical doctor, for us is doctor of veterinary medicine. So after 4 years of vet school, we do graduate with a DVM degree, but we're not residency trained. So if you wanted to become, say, a cardiologist for small animals, you would have to go through some pretty rigorous residency training before getting that board certification.
Okay. So you've been doing this for about 4 years.
Yeah.
Um, how has the experience been?
I'd say overall, it's been very positive in the sense of personal and professional growth. I've learned a lot about not just animals, but people and communication and learning how to balance a very challenging work lifestyle with keeping myself physically and mentally happy and stable throughout this whole thing because it can be challenging just like any healthcare profession. But the one thing I did realize is that we do have to take on much more personal communication with clients than I ever thought would be the case.
What do you mean by personal communication with clients? What do you have to do that, like doctors don't have to do?
Yeah, so we have to justify everything we do because ultimately, you as the client with your animal is paying for all these things, unless you've got insurance, which is, definitely an option these days. But we have to justify every, say, blood test or X-ray or whatever diagnostic tool we want to figure out whether what's wrong with a patient. And every step of the way we have to be in communication with the owners because obviously our patients can't tell us yes, go ahead, do this, or no, don't do that. So getting permission to do things, discussing cost, discussing, in really hard situations, how much do you want to do for your animal, which is a difficult conversation to have with people when it ultimately a lot of times comes down to money. So I did not expect to have so many conversations about so many different topics, including finances, with a lot of my clients.
That must be a tough challenge to go through during the day
Hmm.
of discussing finances and payments
Yeah.
with your clients.
Yeah, definitely.
So, what does your day look like? Does every day feel the same? Is it pretty much a routine exercise every day?
That's a great question. I'd say in the job I currently have, I only see exotic animals, which in my opinion gives me no day looking the same ever. The reason being the species that I'm seeing are so varied. I'd see a small bird that weighs about 20 grams in one appointment. Then my next appointment is, a reticulated python. So I see a huge variety of things that each need their own type of exam and diagnostics and discussions. So that's usually what my day can vary and look like. And
Mhm.
on the daily, I'd probably say I see maybe 6 or 7 scheduled appointments. We have 1 hour for new clients and then half an hour for rechecks or people I've seen before. And we've got some blocked off time as well for, animals that are urgently sick and need my attention.
And of course, your patients, they cannot talk to you. So it's you depend on the patient's caregivers
Yes.
to be able to tell you, what's going on with the patient. Um, do you mostly rely on that to start your diagnosis, or do you like go through a checklist of things that may make the most sense?
Yes, so I usually actually rely on the history quite a bit, especially for reptiles and birds, because they don't in the scheme of things, I can get a super small percentage of information from their exam alone. Most of it, I actually need to know what their setup is like, what their environment is like. Has the owner been giving them the correct vitamins, nutrition? Has it been on a good schedule? Do they have the right humidity levels, temperatures, all those kinds of things? So it is a very nuanced discussion that we have, because if I find that small things have been missed in their care, that can ultimately help me figure out how to fix the problem or what the problem may be.
I see. Um, what has been your most difficult case? And can you tell us why it was difficult?
Yeah, that's a good question. I'd say one of my most difficult cases was during my first year in my emergency job. It was probably one of my first cases of that week. And it was a dog that had been missing from their home for at least a month or so. And they had found it, someone on Facebook had found the dog and located the owners. And the dog was essentially, I mean, there was barely any muscle left on the dog. It was emaciated and had been attacked probably by wildlife. So there were large gaping wounds. He could barely move. It was very, very sad to see. And of course, the owners were distraught because they hadn't seen their dog for months. And
Mhm.
we do everything we can to assess, how much we can do to fix the problems and the wounds and the extent of the injuries he had. And ultimately, it's you as the vet have to be focusing so hard on that and coming up with a plan for the dog and coming up with, an idea of how much things will cost too, because they do have to be hospitalized when they're that emaciated to prevent refeeding syndrome and those kinds of things. And during that
Mhm.
process, the owner's mother, I think the owner was probably about my age, so the mom was handling finances, and so she called the clinic, and I was explaining to her what my plan was for this dog, and we'd have to place multiple drains and potentially go in surgically to fix some of the wounds. And she said, you should be ashamed of yourself. You vets just want to take my money and keep my dog there. So release my dog back to my son, and we'll take care of things at home. And so that was one of my first real, shocked feeling to see that
Yeah.
after two
Yeah.
hours of my, sweat and tears trying to care for this dog that was on death's door, that I was met with absolutely no appreciation, no understanding of where we were coming from, and just
Mhm.
hearing the numbers or seeing the numbers on the estimate, and then assuming that I was just money hungry when I was an intern just trying to help a sick dog. So challenging case, both in the sense of I want to do so much for this animal, but also challenging in the front of there's no understanding from the client as to why we do these things, that it comes from a place of sincerity and true care for the animal.
Yeah, that's indeed sad.
Yeah.
In terms of technically difficult case,
Mm.
what would you say required a lot of you bringing your expertise and training to that case?
This case specifically, or any case?
Any
Any
case, any
case.
case.
Yeah, so since I've done a lot of extra training in exotic species, I did see a African gray parrot that had a broken leg and had been to several vets in the nearby area that the person lived in. And they said, oh, this is a bird. This is completely out of my wheelhouse. I can't help you. And so the bird ended up having, a broken leg for a long time without having anything done about it. So when this bird was referred to me, I was able to see that the bone was still healthy enough for me to go in and surgically fix it with a pin. So we were able to, discuss how we were going to fix the problem, put her under anesthesia, which is very risky in birds, especially older birds. So we have to be very careful how much drug we use, how long they stay under, and how quickly we put them back in recovery. So we essentially have to move really fast in the procedure, from everything from when you give the first injection to getting them awake. So minimizing time, all of those things. And we did end up putting a pin in there to align the bones. And it's essentially like an external fixation. So you'll see some of the hardware that we use is actually outside the leg. So we use kind of this like resin kind of material, almost like hardened Play-Doh to keep everything in place, and put a cone on the bird so that the bird could pick off the bandages and things like that. And ultimately, she did really well. That leg healed up, and she was able to get back to her normal self.
Okay, that's a wonderful outcome. So I assume that you probably do a number of surgeries as well.
Hmm.
Um, so tell me about, what is the most common surgeries that you need to do,
Yeah.
and if there is a surgery that you need to do that is outside your expertise, what happens? Like, do you send the patient to another facility, like a more like a specialty facility? How does that work?
Yeah, exactly like what you said. If there's something that we don't have the equipment for, or don't have an experienced vet in that realm, whether it be, heart surgery or orthopedic surgery, there is typically in every big city now, there's either one or multiple specialty referral hospitals that we can work with to get these complex surgeries done. So that's usually what we do. We give them a call, we work with them, we say, go in for a consult with the surgeon here, and we're able to send a lot of our patients to get more complex things done.
Got it. And you mentioned equipment.
Mm-hmm.
So, a typical veterinary practice, what do you folks have in terms of equipment that is like the minimum required?
Yeah, I'd say at minimum, most veterinary practices are going to have some sort of in-house blood work machine, so we can run some chemistry panels and complete blood counts. And X-ray is pretty standard at most veterinary hospitals as well. We also have a microscope to do cytology. So we look at fecal samples, skin samples, ear infections. We, take swabs of the ear, things like that. So microscope slides and the stainings that we need to do for the slides to fix them.
Okay, what about things like MRIs, or do those require a more bigger facility to have those?
Yeah, it's usually a bigger facility, and in most cases emergency or specialty hospitals that have a higher income as well, just based on the volume of patients they see and how many of those patients will actually require advanced diagnostics.
Okay, got it.
Mhm.
Um, I asked this question to a lot of my guests is, what aspect of your job is most enjoyable and why?
I'd say just simply seeing animals and the way that they interact with their owners, with us. I mean, the most obvious thing is that animals are pretty cute and pretty fun to look at. So that's there, and it's cool to be able to handle them and take care of them. But just seeing an owner's love and care for their animal is super enjoying and satisfying for me to see, because that's kind of what I live to do, is to keep that bond alive and to do all I can to help keep those animals happy and healthy.
Okay, and of course uh, the satisfying aspect is seeing the animals get well,
Yeah,
and that's always a nice thing to do, right?
of course, always. Yeah.
Yes.
Yeah.
Ladies and gentlemen, we are talking to Sneha Krishnan. She is a veterinarian working in Seattle. She works in two locations, and she just moved from Nashville to Seattle, and she loves the work environment at her workplace, and the animals, of course, are also happy at the care that she provides. We'll take a break, and we'll come back, and we'll talk about about the state of the industry
I
and
guess
other
when I was at
topics.
Seattle Humane,
Stay tuned.
I loved doing, we would do rounds, so we'd do all the different, departments,
Yeah.
like the ICU, everyone knew what we're all doing
Yeah,
that day.
nice.
Yeah,
So Saturday will be quick.
good way to get us all to do it.
Both front desk are, they're on the phone, so I'm trying to get one of them.
So they can at least, listen out.
You sign those and then they can find their way to Allie or Wendy.
Alright, so JD and Sneha, obviously Sneha's first one canceled. JD has all birds today. A couple tech appointments, Wagner's for the nail trims, some ferrets for the front of blood work. Nicole called out, so I'll be helping Sneha and do tech appointments as best as we
Yeah,
can.
you can go. I'll help too. Like I haven't looked, but when you said Wagner Mines, I can. I'm very familiar with them, so I can help as well.
Okay, cool.
That.
And then I'm hanging out with Ray after work, so if you're still here and you want to say hi to her. And then my birthday of the day is Mary J. Belage, she's 54.
Cool. Nobody's got a joke. We used to have one joke every morning at Seattle Humane. Somebody do the worstest dad joke they could come up with.
I can add that
Yeah.
to the list.
Yeah, it was
Bad
funny to
joke.
end our meeting. We would do one bad dad joke before we headed out, so we get a good chuckle.
I made a last minute, I haven't put it on the schedule
Oh.
yet, but I made a last minute site visit appointment in Seattle for a quick one this afternoon. Probably ducking.
Welcome back. We are talking to Sneha Krishnan. She's a veterinarian in the Seattle area. Sneha, hi. Before the break, we talked about the aspect of your job that is most enjoyable. Flipping that, what aspect of your job is least enjoyable? And do you have any idea how to fix that?
That's a great question. I would say, we kind of touched on this earlier, but having discussions about finances is not something that I think should be a routine part of a medical doctor or any doctor's, day, because it does cloud, our judgment and the things we offer, because I wouldn't be able to offer the same amount of care to someone who is able to spend much more on their animal than another. So I think, of course, one of the steps we have to take in that direction is standardizing insurance for all pet owners, and in many cases, making it a requirement upon adoption to have insured pets, because that takes so much of the stress, the decision making, and a lot of the uncomfortable discussions surrounding a pet's care away if we brought insurance into the picture. So that is something I think, and I'm pretty sure will start to pick up in the next few years. But having a standardized insurance plan for especially dogs and cats, since that's the majority of pets in this country, would be a first step towards making that better.
Why is it that you think people don't take pet insurance?
Yeah, so I think a lot of it is just not enough discussion around the topic yet, and there don't seem to be enough insurance companies that have kind of partnered with vet hospitals and put their names out there. And when people do buy dogs or cats from breeders or adopt them from the shelter, it's pretty rare that they're having that discussion about insurance. So something I try to do is, if I ever see a new pet or a new puppy, to have that discussion off the bat so that they get insurance when they're younger, and that they
Mhm.
don't have any trouble covering pre-existing conditions when their dog is 15 and having issues and they realize now that they can't just get insurance. So I think just not enough communication about it is the bigger hurdle that people need to start addressing.
Got it. So one part of your job is to keep up with advancements in, say, technology, in equipment, in new findings.
Mm-hmm.
Um, how do you do that? what are some of the tools and practices that you use to be up to speed on in your industry?
Yeah, so we do have, in terms of education, we do have requirements for continuing education every year. So depending on the state in which you're licensed, you have to accrue a certain number of hours, and that could be attending a conference, watching virtual lectures, attending labs in which you actually get some hands-on experience. So say you want to learn endoscopy, you could go to a lab where they teach you how to do endoscopy. So those kinds of things count towards continuing education and help us stay on top of the newest advancements in the field. And as far as technology, there have been some great advancements in diagnostic capabilities. So, we have microscopes that will upload images to the cloud, and pathologists can review them within a few hours and tell you if the dog's lump is cancerous or not, those kinds of things. So there's quite a bit of advancement in the field across the board in getting good diagnoses fast for pets.
And you said conferences.
Mhm.
So, what are some of the conferences that you have attended, and what is mostly the focus of these conferences?
Yeah, I've been to, of course, given my focus, I just recently went to the American Association of Fish Veterinarians conference, where we had, a couple hundred attendees that were from all sorts of, realms of the aquatic space. So some were, aquarium veterinarians, some did, pet fish work, things like that. Some people did sea turtle work. Um, and the other conferences, we do have like the annual AVMA conference. So the American Veterinary Medicine Association, they put on, a few days of courses about new medications that have come out. They have different tracks you can take. So if you're interested in certain parts of the field, you can attend those, things like that. And they also present lots of new research about a variety of things. So that's another big conference that people attend every year.
Mm-hmm, mm-hmm. In your workplace, so you have veterinarians.
Mhm.
Who are the other people that work with you? What are their titles look like?
Yeah, it's a great question because they're extremely essential to the running of a hospital. So we've got veterinary technicians, and vet techs actually, put on so many different hats every day. They run my anesthesia, so they act as my anesthesiologist when I do surgery. They are the nurses, so they calculate medications, give all the drugs afterwards, set up IV pumps, all those things. And they also are basically your scrub tech, so they can scrub into surgery with you and assist you. They are also involved in really communicating with clients. So after, say, a long procedure or a hospitalized case, they do all of the discharges with the owners there and go over the plan and all of those things. So they do put on a lot of hats, including being phlebotomists. They get X-rays for me, they get the blood work done, all sorts of things. So that's a technician, and in most states, I think right now you can go to school to become a licensed veterinary technician.
Mm-hmm.
Um, and then we've got veterinary assistants, and assistants do, they hold the animals in the room, they restrain them for procedures. They will label in all my samples and get things out the door, like my blood samples and other tests and diagnostics that we run. They get all the patients checked in and get a history on them. So they figure out what the main problem is and then come back and tell me a brief rundown of what they think is going on before we
Mm-hmm.
go into the room and do the exam and come up with a plan. So those are the, main I guess, staff involved in seeing patients. And then, of course, we have our reception staff that to field all the phone calls, get the schedules set up and everything like that.
Okay, and specialists work in a different facility, um, uh, right? Because the specialists are not usually available in the same facility as a clinic, right?
So specialists, so those who are board certified, it depends on what their setup looks like, but usually they either work at their own clinic if they own it, or they work in kind of a large specialty hospital where they have everyone there. So they have the internal medicine doctors, they have the cardiologist, the radiologist, because they can all work together as a team to solve some hard cases.
Okay, okay. All right. What can you tell us about the state of your industry? Or people happy working as veterinarians? What are the challenges and what are the rewards?
Yeah, that's a great and relevant question. Since COVID, there's been, as you might have heard, a huge surge in pet ownership. And along with that has come, of course, challenges in the vet field, which include, not having enough time, being burnt out, seeing way too many patients per day. So what and the veterinary field already had its challenges in the sense of most veterinarians are in a huge amount of debt from school, and in the healthcare field, in the grand scheme of things, we're not the highest paid group of practitioners. So
Mhm.
balancing that with a large amount of school debt, and then a lot of the things we talked about, the emotional toll that it can take, seeing hard cases and dealing with difficult clients, can definitely make that process a little harder. So unfortunately, on a grand scheme of things in our industry, veterinarians are plagued with a lot of mental health issues and high suicide rates. So, you know, the second part of your question, I think, was kind of, what what
Or
could be
people,
done.
yeah, what could be done? Yes.
Yeah, and there's a lot of work going towards extending more resources for vets to be able to discuss and address their mental health concerns. There have been a lot of initiatives, especially in amongst owners of vet practices, to help with loan repayments, to help make sure that salaries are competitive, especially for our newer graduates in the recent years. So that has
Mhm.
been all upward trends that are certainly something that still needs to be worked on, but are going in the right direction. But I think a huge part of it too is the staff turnover and having enough, support staff to maintain your own practice is the hard part there, because lots of people, especially as we talked about, they do kind of let out their anger and frustration on the support staff, and that does not lead to good retention in many vet hospitals.
I see. So people get stressed because of feedback from clients.
Yes, that's across the board what I've seen. It's never and very rarely a problem between me and the support staff or the owners and the support staff. A lot of times it is the way that clients have treated them, and then the way that the hospital has responded to those client interactions that tend to make people not want to stay at a certain position.
Hmm, hmm, hmm. And as you may have heard, the new buzzword is AI. And have you seen usage of AI in your practice? And if so, what form has it taken?
That's a great question that I have not seen personally in my practice yet, but I do personally use AI to help with my record writing and template making. So I've automated some templates for, instructions for owners to take home, where I can kind of fill out per patient, depending on what condition they had and things like that, in terms of saving time. But I think we're still a little behind in using AI in other realms of vet med in our hospital right now.
Okay, okay, interesting. So maybe you can use that opportunity to do something in that field.
Yes, I do definitely want to implement the talk to text kind of thing where we can dictate our notes during exams. That might be really helpful.
Right. Um, so in terms of pharmaceuticals,
Mhm.
Can you tell us anything about what is happening in the field of animal pharmaceuticals? What research goes on there, and what has come out of it?
Yeah, so in the terms of in animal pharmaceuticals, there have been a lot of new breakthrough medications that people have developed for chronic diseases such as arthritis, which tends to plague a lot of dogs, especially as they're living longer with good medical care. There have been a lot in the realm of parasite prevention and heartworm prevention. So lots of medications that are life-saving for dogs in areas like, the South where there's lots of mosquitoes and heartworm disease is very prevalent. Just a once monthly pill or a once yearly injection can, prevent them from getting heartworm and gives them about 99% protection. So medications like that. There also have been huge developments in allergy medications, so preventing seasonal allergies as well as chronic allergies, so scratchy, itchy dogs. They've come up with some good preventative medication for that as well. And Zoetis and Merck and some of those big names you hear are kind of the bigger ones pushing development and research in those fields.
On that positive note, Sneha, thank you very much for your insightful comments and observations on this podcast. So I really learned quite a bit about the veterinary field talking to you. So good luck in your career, and all the best in your practice. Thank you so much.
Thank you. Your questions were very insightful. And of course, thanks for being a supportive dad through the journey of vet school.
You're welcome. You're welcome. Here is a recording of Sneha meeting with her client. Please enjoy this recording.
Hi, how are you? All right. So we've got Dash and Mochi here. Hi. Oh, they're so cute. Oh, perfect. Okay, so we'll just chat with you real quick and then we'll take a look at both of them. Okay, so both around 2 years old. So you got them in 2022? Okay, nice. And both males. Okay, cool. And I read through your husbandry and everything you've been doing. Looks great. So tell me, any medical history with either of them? Have they ever been sick or needed veterinary attention before?
Never.
Awesome.
When we got them from the Petco, there was no visible problems.
Great.
Mochi was a little bit more stressed, so he was losing fur
Okay.
just from being uncomfortable.
Sure, Mochi was? Okay. Okay.
And then more recently, it appears that Dash has been bullying Mochi because Mochi has a little bit less fur in a particular area. He was losing it.
His ear.
Around his
Oh, yeah.
ear? Okay, and I mentioned there was an ear bite or something like that? He bit, okay. So Dash has been biting Mochi?
Yeah.
Okay.
And I think a few weeks ago, what we noticed, Mochi's his poop was a little bit more mushy.
Oh, okay, okay.
But it's been better now. So
It's gotten better,
we
okay.
separated him from Dash, and then
Okay.
it seems like he's better now.
Good, so maybe stress related, maybe a little bit of bullying going on.
Could be diet as well. We changed
Okay.
hays quite a few times.
Uh-huh.
There was one that was particularly filled with carrot or something, and that's when the Mochi poops.
That makes sense, okay. And then you switched him back to just regular Timothy hay after that?
Yeah.
Okay.
I don't know. Also, maybe mating season or something. Maybe
Oh
more
yeah,
aggression,
it's
just
weird.
because-
You're just seeing some more aggression. Did this happen last year, or this is all,
This is all
of
recent.
recent? Okay.
Since December.
Yeah.
Everything before December was chill.
Okay.
They would cuddle and they'd play.
Oh, okay.
They would be like sleeping together, so we would like check on them, and it would just be
And they're
cuddled
together.
together. Yeah.
Okay. Okay. We'll see. Maybe if Mochi's exhibiting more stress, that Dash is finding it easier to pick on him and things like that.
That would make sense.
Yeah.
Which is kind of the crybaby of the group.
Okay.
Dash is more like the aggressor.
Yeah, he cries at night to get attention.
Aww.
We have them in a 3-story cage.
I saw that. Yeah, that's great. And relatively, they've been active and otherwise eating, drinking fine.
Mhm.
Okay, great.
Except for they pull out all their hay. They don't eat it. They pull it all out.
Yeah, they're looking for the perfect piece.
Yep.
Yeah.
Of course. All right, great. And then I assume they've got dust baths. They're using those pretty frequently and no problems.
Yeah,
Okay.
recently, so before we had like one of the more standard ones that's like enclosed with like a hole on the top.
Mm-hmm.
It's like an egg shape.
Yeah.
And then more recently, she got a wooden bowl that's like big and empty,
Uh-huh.
open
Nice.
on top.
The open ones, yeah.
Pretty cool because now they can fit because
Oh,
they're
nice.
too big for the egg one.
Yeah.
Yeah, for the individual ones. Yeah.
Yeah,
Okay.
I have for my boy. I have a bin, and I just cut a hole in the side because he uses that. It doesn't really contain it.
It gets everywhere. Yeah.
Seems like nothing really.
No.
No. All right,
That's
great.
neat.
And did you have any specific questions? It sounds like you're thinking about boarding them here, so you wanted to get some details on that. Yeah, for sure.
We're going to Japan for 2 weeks.
Okay.
So,
That's exciting.
instead of using family and friends, it would be much better to put them in like a facility where people kind of know what they're doing.
Sure, for sure. Yeah. And we can show you our boarding area too after the appointment, and you can see kind of what kind of animals we have there. But
Cool.
yeah, great, awesome. And we don't really require any specific testing, but if I find anything abnormal, then we might talk about doing anything before boarding them, just because
Yeah.
stress can make things show up that necessarily didn't show up at home. So, all right, great.
We think that Dash runs on the wheel more because he's more athletic.
He's more- okay.
And so as a result, his claws are not as sharp.
Ah, okay, gotcha.
But like
He's a little more
none of them-
active.
None of them really like claw or bite. I mean, I have a Harry Potter scar right now because Dash was on my face, but that's just because he likes to explore.
558. This is Mochi. 558.
Wow. Wink, wink.
Yeah. Do they like being handled at all? Do they tolerate it?
I don't know.
Yeah.
They
Hard
just-
to tell.
Every time we hold them, they just want to escape.
Yeah,
Everything they
I mean,
wanna do
that's-
is
that's
just
normal.
escape.
You are so cute.
Good
So cute.
Good job.
What is that bright light? Can I see this
Gotta look
one?
at your
Can I
eyes.
see this one?
It's okay. We'll look at it.
There you go. Yeah.
Good. Good job.
So squishy.
Okay, can I see your mouth? This is the part they hate the most.
Yeah.
Just to warn you.
I tried to
We're gonna-
check on my own, like
On like the front teeth.
Yeah, but
Yeah, I'm gonna bundle you
Yeah,
up.
they don't like
It'll just
it.
be for a second. I don't want you to get too warm.
How cute.
Get your ear.
Dash burrito.
Yeah,
Right?
little burrito.
Get in there.
Okay, good. Incisors look great. And this is Mochi, right?
Yeah.
Okay.
You can see on his left ear too.
Mm-hmm.
I was kind of surprised that the bite went all the way through his ear. It was like a clean break, and now it's kind of starting to scab over.
Oh yeah. Oh, I
Were you
see
able
that.
to
Oh
see
yeah,
it?
you're right. Yeah, I saw that.
Okay, cool. Okay.
They have such
Wrap you.
thin skin, and like it's so
I know.
easily breakable. But we'll check that. Yeah. Oh, I know.
You're doing great, Mochi.
Good. It looks like he formed a nice little scab and it's healing well. It might take a little, there might always be a hole right there. I don't know if it's gonna really oppose well. The only way to really fix it would be to really like cut it and suture it together, but we don't usually do that. Unless it's infected or bothering them. Yeah? Okay, can I feel under your jaw? Good job.
I was joking that Dash gave him an earring.
Oh yeah. Well,
Yeah,
you're saying.
little ear piercing. Good. Okay, just listen to your heart.
Yeah, that's a good job.
we didn't really notice any of the aggression like firsthand. I think
I
the only
did.
thing was like
Oh.
she stared at them for like an hour
I
straight,
was just
and
watching.
Mm-hmm.
it was just kind of like pouncing. Dash would pounce near him.
With longer not Mochi.
Okay.
Mochi's a runner, so I don't know if that just makes Dash that like want to chase after him, but
I have like a ring camera on my chinchilla cage, and then I can watch them from when I'm not around.
That's so cool. I was thinking about putting them like live on stream.
Yeah. Oh, where are you going?
oh good, Mochi. Yeah. Looking better now. Do you need help?
Yeah? He's like, what are you doing now? Okay, we're just gonna feel your little belly, okay? Down. There we go. Perfect. You can look over that way. Yes, there you go.
No, honestly, I'm sure they did. I'm sure they did.
Alright. Good. Okay, and then will you hold him straight out and I'll just take a look at.
No, I gotta turn you around.
Oh, I
it's
know,
okay.
I know. Good. Feet look great.
Oh, great.
No evidence of the bumblefoot, which is that swelling.
Yeah, that was
Redness.
one thing
I know.
Here, I'll support your feet.
There,
Alrighty.
that's perfect.
He's
Okay.
just up.
And then let me see your tail. Looks great. And then I didn't see your front paws. Can I see your front paws? So tight. Perfect.
The cage originally came with like plastic inserts, but we've since changed everything to wood.
Okay. Yeah,
Great.
that's
Yes.
good because plastic,
That'll
yeah,
work,
they
yeah.
will tear that apart. And
I'm
then,
always like, why do you guys have to eat everything you chew?
right?
So they gave his name is Jelly Donut. I put some paper in there, and he was just like, I took it away after
I got
like
it.
20 minutes because I don't want him to eat a bunch. Alright,
All right. Perfect.
Dash is as his name is, he's the runner.
Yeah.
He's the runner. Okay.
Hey, Dash.
Gotta stay still, Dash.
Are you a badass now, Dash?
I guess we'll do it without the towel.
That's
So I
fine.
can tear it now. Oh,
At least Dash won't pee on you. Mochi probably will.
He didn't though, so that's good. Dash.
608. That makes more sense. Okay, good.
Oh.
Go.
It's a good stand.
Just check things out. You don't need to, run around. Just check it out.
We got proof that Mochi's bigger now.
Yes.
Yes.
I can tell.
Sweetie.
Hello.
Oh,
Hi.
you stand like that.
Looking far away.
I know, I gotta look for me.
Can I see your eyes? Sorry, I'll hold you. You're wiggly.
Thanks to you for tuning in. We always like to hear feedback from you. You can tweet to us at Carabiner Media 1. That is CARABINERMEDIA and the number 1. You can also send us email at startupfeedback@carabinermedia.com. We hope you share this podcast with your friends and colleagues and also rate us in your favorite podcast platform. See you next time.